everyone. Thank you for joining me for today's episode of Grilled. I'm Andrew Neary, the owner of Drinks and Dragons Board Game Cafe, and I'm joined by Dr. Pepi McTavish, Durham Region's Assistant Medical Officer of Health. Today we talk about PPE, mask use, the guidelines going on, and good sources of information as things change. And we look forward a little bit to what's going to happen this summer. I hope it's helpful and you guys enjoy today's episode. Thank you. Thank you for joining me today. I think my first real question that I like to get started with is just what is it exactly that you do with public health, and how are things going on that side? It seems like you were just mentioning how busy everything is. How would you hold up in kind of this new insanely busy environment?
So, my role at the health department, I'm the assistant medical officer of health. So that means I support our medical officer of health, Dr. Kyle, in doing all things public health. So health protection, health promotion. Our big piece right now is infectious diseases, as you know, with COVID-19. So the biggest piece that we are doing right now, I would say the two biggest pieces are case and contact management. So that is bread and butter public health. So we find people with disease in the community. We're aware of them. And then you have to make sure that that disease from that case does not spread. So a big piece of that is finding the contacts. It's a very important investigation method that the nurses and public health inspectors engage in to ensure that that disease does not sort of propagate beyond the case and the close contacts. So that's a big piece. The second big piece is surveillance. So I'm not sure if you've been to our website. It's excellent. The epidemiologists who work for the health department are absolutely superb. And we have a wonderful data site. It's durham.ca/COVID cases. And there you can see all the cases, all the unfortunate deaths that have happened. You can break down long-term care and retirement homes who are in outbreak into staff and residents. So surveillance is a very large piece of what we do, because until we sort of know what's out there, it's harder to control it. So this way we have a much better sense with our surveillance piece, but also we're being transparent with the community about the information that we have. So right now those are the two biggest pieces that we're all working on very diligently at the health department.
Wow. I mean, that sounds like a kind of the best way to get things going. And with everything with the lockdown and social distancing, that would probably make surveillance a lot easier. But now that sort of the restrictions are being loosened gradually, what kind of challenges do you see that imposing on being able to track what's going on as people are able to start getting out a bit more?
Yeah, so really great question. So I know it's actually today too, right? May 4th, that certain seasonal and essential businesses are going to be allowed to open. But this doesn't mean that, the doors fly open and the lights get turned on. Certainly, it's a very slow, steady, measured opening. So it's certain, for example, like garden centers are open, but you still can't roam around and pick out your plants. It's still curbside pickup, and golf courses are open, but not to play, just to prepare for the season. So public still can't use them. So these are like slow and steady measures. So I don't think that people will all of a sudden rush out and decide that they want to stop the public health measures that everyone has been so great at doing and sacrificing for, social distancing, continually washing your hands, wearing a non-medical mask in public if you can't social distance. So I think the public is being exceptionally wise and smart and being great in realizing that all those public health measures need to continue, even though some businesses are going to start to open. So if we don't engage in these public health measures, we will certainly start to see our cases and subsequent deaths rise again. And I do think that everybody is very aware of that. So hopefully we don't see that happen again, but that's why this will be a very slow and steady reopening strategy.
Awesome. Yeah, I think people are definitely taking it seriously. There's a lot of people, and especially on like the Facebook communities for caremongers and stuff like that are trying to make sure that they can continue to embrace social distancing, but also support people during this time in kind of a clean, healthy way. Is there any?
Well, there's been so much community support. It's wonderful. You see, if your neighbors are standing too close, someone gently reminds them,
Yeah.
I don't think that's 2 meters, maybe take a step back. So I think the public is really almost monitoring themselves, which is really fantastic to see. Everyone has a big role to play and they're in it together.
Is there anything else people could do to maybe kind of go above the call of duty to make things easier or more sustainable?
I think some of the things we've seen that have been really great is certain people in society are more at risk, as we know, people over 70 or people who have underlying medical conditions. So we're really seeing neighbors and friends and family go above and beyond when they do the things for those people who should really be staying at home. So, for example, if your parents or your neighbors are elderly, and then you pick up their groceries or you go to the pharmacy to pick up their essential medications, because we're still, trying to stay home as much as possible, only going out for those absolutely necessary and essential trips. But when we do that for the people who really should be home and self-isolating, I think it really shows the best of our society. So it's been great to see that.
Awesome. Now, sort of as things open up today on May 4th and move towards the summer, I know there's a lot of talk and pressure about summer programming and people who are going to want to get out and enjoy the weather. Are there any new challenges that you can see coming up specifically with the season change, and any important guidelines to be aware of for people as we go into that?
Well, I think that's a great question too. I think everyone's getting sort of that spring itch. Everyone wants to be outside. Yesterday, I don't know where you live, but it was beautiful where I live. I think it was 18 degrees and sunny. So
Wow.
everyone wants to be outside, but everyone knows the work they've been doing is working. Like everyone is seeing in the media now, we're flattening the curve. I don't know if we're totally past it yet. You don't know you're past it till you look over your shoulder and it's gone, but we're definitely flattening it. And people know that the work they're doing is making a difference here. So I think although they're going to be excited to be outside, I think people are going to be really wise and they're going to keep up the physical distancing. They're going to be smart. They're going to wear a mask if they can't physical distance. They're going to continually wash their hands. Hopefully now this is a lifelong thing that people are going to consistently have great hand hygiene. So although people are going to want to get outside, I think people are going to be smart. I do. I think they're going to just keep doing what they've been doing. I have faith.
Awesome. You mentioned earlier too about the benefits of wearing a mask. I think there were some people even yesterday. It was so nice out going out and jogging in their non-medical masks and being a part of the program. Are those masks really effective, or is there any sort of special thing to look out for if you're buying a non-medical, non-surgical mask to make sure it's still helpful?
No, so in general, basically, you would want to wear a non-medical mask if you couldn't social distance. And really, it's to protect other people from you. So it's your germs, your saliva, your droplets staying in your mouth and not spraying on other people. So if you're a very heavy breathing runner, it's very nice of you to actually wear that mask, bandana, any sort of cloth covering, because it keeps your germs and your droplets to you. But if you can get out and social distance, you certainly don't need to wear one. It's you want to wear one if you cannot social distance. So no, they all protect you. All the cloth ones, all the non-medical ones just protect your droplets from getting onto others. But
Awesome.
running is a good point because we've had a lot of questions at the health unit about can I go outside and run? And yes, it's nice outside. People certainly should get outside now, run, walk. The big thing I would say is maintaining that physical distance. We've heard of some trails and parks reopening, and it's just everyone's flooding there, and you just can't maintain that physical distance. So that wouldn't be a great idea. But getting out, walking, running earlier in the day, later at night, as long as you're doing it by yourself or you're distanced or it's with somebody in your close family that you still live with, certainly we encourage that.
Awesome. Yeah, definitely getting that immune system built up too by being active, I think, is something people are talking about in terms of
Yep.
keeping yourself healthy.
Well,
Um,
and your mental health too, of being stuck inside for so long. So important.
Definitely. There's a new announcement too about extra funding going into mental health, which I think is going to be very helpful and very
Oh,
important
yes. Excellent.
all
Yeah,
the time.
agree completely.
Is there anything that Durham in public health especially is doing, beyond surveillance, or that is doing a little bit differently that you're finding is working really well versus maybe other areas?
No, so I think so. We're led in public health. We're led by the center. We take direction by Dr. Teresa Tam federally, and then locally the Chief Medical Officer of Health, Dr. David Williams, and all of our guidance comes centrally, um, which is great. Sometimes you might tailor it different in your public health unit. For example, if you're a very urban unit and you have more cases, versus maybe a more rural area that has less cases, you might have more restrictions or lessen your restrictions a little earlier or later based on that. But we all have the same information. We tailor it sometimes a little bit differently to our local groups, but every health unit will have a fantastic website. I will say that Durham's is excellent. It really is a great place for resources. The most update and correct information. Sometimes there can be some concern about false news that's out there. So if you come to our website, you can certainly get the correct information. So I would say that's a good place to look for guidance is the durham.ca/novel coronavirus website. It's excellent.
Awesome. I'll definitely be linking that in the show notes so that everyone can have an easy access to that site. It's also a pretty easy
Oh, good. It
website to
is.
remember.
Yeah, it's an excellent website.
So when it comes to the loosening of the social distancing, kind of as things go on, and we do take this really measured approach, do you think there's any sort of headway towards families that have been separated and are socializing separate or social distancing apart, or couples that ended up having to be separated? Kind of what is the future there, do you think?
Oh, it's a great question. That's so hard. I haven't seen my parents, my kids haven't seen their grandparents since this all started. So I certainly empathize with everybody. I don't think we're there yet. I think we're seeing the slow and steady start to businesses, some essential businesses reopening, but I still think we're not there yet with loosening of the physical distancing restrictions. So yeah, so right now, unfortunately, families still need to social distance and physical distance and not come together. It's spring. People want to have picnics and barbecues. I totally understand that, but we're not quite there yet. We need to see not only that we've, flattened the curve, but we need to get over the curve and sort of back down to baseline before those restrictions can be lifted.
Is there kind of a goal baseline, or is this kind of a general, trend that we need to look for? Is there like a particular number that the public can be kind of looking forward to, or is it just kind of
No,
wait
so I
and
think
see?
Yeah, that's a great question. It's a bit more wait and see. The government does have a great sort of four-pillared approach to this. So it's more than just the virus being sort of at a low rate in the community. It needs to be that we've contained the virus spread. We know that the health system can maintain if we start to see more or less cases. The public health system has to have capacity. So this case and contact management I was talking about. And then we need to have the ability to track like the surveillance in the community. So it's more than just the numbers of the COVID cases going down. Everything is sort of a piece in the puzzle, but I think this measured approach is good. It will certainly give us some idea, and then based on this, we can sort of snowball and decide what the next steps are. So, if you ran this podcast in 2 weeks, 4 weeks, the answers will probably be really different, and we'll be able to look back and say, oh, in hindsight, we should have known this. But right now, it's just low and slow, and then we'll look at the data with each measured approach, and go from there.
Yeah, it's definitely been a lot of daily changing, so it's got to be tough kind of keeping everything moving and all the different pressure. So you guys are doing a
It
great job.
is. We made recommendations like a month ago about masks, and I was on a different show and I said, oh yeah, no, you definitely don't need to wear a non-medical mask. And then a few days later the guidance changes, and that's actually what's so great about public health and medicine and research. When evidence changes, you change too. The positions change, the policies change, and I think that's actually wonderful. So if you run this podcast again in a bit, maybe there'll be things that have changed. But certainly the information changes. But if you do actually head to the Durham.ca novel coronavirus website, everything that's on there is up to date information.
Awesome. Well, I think that's kind of the main questions that I had for you. There's just two more. The first one is there anything that you particularly would like to share as sort of like a last note for people to keep in mind? Any sort of important final takeaway from this?
I would just say that we know everyone has made large sacrifices and it's obvious, and we can see that with the community cases coming down. So, really, just thank you to everybody and stay the course. This is a marathon and not a sprint. So, we're not there yet. Hopefully, we'll be there midsummer or soon, but everyone's made sacrifices and they have not gone unnoticed, and they have made real differences in the community.
Yeah, thank you, everybody. The last question I have is who do you think would be important for me to speak to next, or someone that people should hear from? Do you have any sort of recommendation on a good next guest that would have information for people?
I think a great next guest for you would actually be somebody who works in the long term care sector. To understand sort of the pressures faced by that system and what it's like to be a frontline worker in that system. I think that would be, especially with the outbreaks that we've seen across Canada and Ontario and locally in Durham region, someone from the long-term care sector, I think would be an excellent guest, and I would certainly turn into that podcast to listen as well.
Awesome. I will track them down. Thank you very much for your time today. This was really informative, and I think it's going to get a lot of good info out to people. So thank you.
It's my pleasure. Thanks so much, Andrew.